First of all, this is a Tuesday afternoon. My Tuesday afternoons always, since I've been here, have been my scope clinics or my endoscopy clinics. They're where I do colonoscopies, upper GI endoscopies, these procedures where I put tubes into people to try to figure out what's going on. Why are they bleeding? Why are they anemic? Why are they losing weight? And then also, for those who are simply human with a colon, because colon cancer is such common cancer in human beings. But also we know in British Columbia, First Nations have a much higher rate of colon cancer than the average British Columbian. So it's even more important that we get that screening, and that screening is also done for people who have no symptoms whatsoever and no problems. But those are Tuesday afternoons for me. And because of COVID, I have this honor of being with you here today because the entire endoscopy clinic is shut down for people who don't have symptoms. That might be just walking around with cancer, but because they don't know it yet, they don't have the voice to cry out for help, and neither do their primary care providers, and neither do their surgeons or other people that would otherwise help them get the care they need. So we know as physicians that there are people walking around in British Columbia, in Northern B.C, in your communities that may have polyps that can be removed to prevent colon cancer, or that might have symptoms that are wondering why are they having these symptoms and are increasingly stressed trying to figure this out. And I'm with you here today because I can't help them because the endoscopy clinic is closed. Now the endoscopy clinic is open for those who are bleeding and those who are that need emergency care. So certainly Northern Health is working with its partners to try to provide as much care as they can, but we really are slowed down in that area, which is why I can be with you here today. Kind of ironic. Interestingly enough, as a surgeon also, even if I were to diagnose symptoms or diagnose someone with a cancer that is unsuspected, then getting access to the operating room is extremely challenging at the best of times. We know for years, decades, since I've joined the medical profession, we've been complaining about surgical wait times. Except in UHNBC, there's 7 ORs, 3 of which are working now, partly because of shortage of nurses, partly because of the resources, partly because there are no beds to put someone after they have their operation to recover, because they're filled with people who have COVID disease, and the entire restructuring of the hospital to fill the needs of patients who have COVID, which Dr. John has already stated, are highly in the unvaccinated population now. So the ORs are being shut to our loved ones, our community members, our family members, and ourselves because of COVID. And that's a major issue. The other thing is that we might not even know, like in order for me to put in paperwork to say that this person needs an operation, sometimes they need, for example, in cancer, they need staging procedures or other tests. They need lab work, which now is harder to get because you need an appointment. They need CAT scans or MRIs or PET scans, and those are harder to get because it takes longer, because they have to do, it's much more inefficient. They have to do so much more to clean between each patient, and there's less human resources because people are getting burned out because of the overload of it, or they're getting COVID and then have to step away. So the impact of it is along every step, from symptoms or those up to date for screening, to getting their screening tests or their tests, to getting the additional test before the OR, all the way along. And it's impacting the care of ourselves, our loved ones, our community. And it's really, really hard to advocate when we can understand that the hospital is filled with patients who have COVID and that concern. And it's so, so important because vaccine can play such a significant role in shifting that back so that we can care for all of our community and have the resources to do that.